Are you or a loved one struggling with the costs of home care, particularly when health needs are involved? In this video, we'll explain what NHS Continuing Healthcare funding is and how it can help cover the cost of care when you have complex health needs. Hello, Shamai. I'm Joanne from Living at Home. We know how challenging it can be to manage the financial side of care, especially when your needs are more health-related than just personal care. In this video, we'll be focusing on NHS Continuing Healthcare funding, who's eligible, how it works, and how it can help reduce the financial burden of home care. By the end of this video, you'll have a better understanding of NHS Continuing Healthcare funding and how to apply for it. Let's start by explaining what NHS Continuing Healthcare funding actually is. NHS Continuing Healthcare is a package of care funded by the NHS for individuals who have complex health needs. This funding is designed to cover the full cost of care, either at home or in a care home, for people whose primary need is health-related rather than social care. What makes CHC unique is that it covers both health and personal care needs, so it can pay for things like medical treatments, nursing care, and other healthcare needs that would otherwise be your responsibility. If you're eligible, the NHS will pay for your care in full. This can be a huge financial relief, as it can save thousands of pounds every year. Did you know CHC is often underclaimed? Many people don't realise they or their loved ones might qualify for CHC funding, and it's estimated that thousands of eligible individuals miss out on free care because they are unaware of the criteria or how to apply. Advocates often stress the importance of checking eligibility. To qualify for NHS Continuing Healthcare, you must have what's called a primary health need. This means that your care needs are more related to your health than to social care needs. Some examples of health conditions that might make you eligible for CHC funding include long-term illnesses like stroke or heart disease, conditions such as Parkinson's disease, multiple sclerosis, or dementia, terminal illnesses, severe and complex mental health issues, neurological conditions. Eligibility is based on your health needs, not your income or savings, so it's available to anyone who meets the criteria, regardless of their financial situation. Did you know CHC is one of the few truly free services in adult social care? Unlike most adult social care services, CHC is completely free for those who qualify. This includes not only healthcare, but also personal care and social care needs, making it a lifeline for many families. To determine if you're eligible for NHS Continuing Healthcare funding, you'll need to undergo an assessment. The assessment is done by a healthcare professional who will evaluate your health needs and decide if you qualify for CHC funding. This involves looking at the complexity, intensity, and frequency of your care needs. It's important to note that the process can sometimes be complex, and the decision isn't always straightforward. If you're unsure or feel the assessment didn't accurately reflect your needs, you can request a review or appeal a decision. Did you know NHS Continuing Healthcare can sometimes fund holidays? If an individual qualifies for CHC and requires care during a vacation, the NHS may arrange or contribute to the cost of providing care while you're away, ensuring continuity in their support. If you qualify for NHS Continuing Healthcare funding, it can cover a wide range of services, including personal care, help with bathing, dressing and other personal care tasks, nursing care, if you need professional nursing support, medical treatment, care related to a medical condition that needs ongoing monitoring or treatment, specialist equipment, any aids or devices needed to manage your condition at home. The best part about CHC funding is that it provides comprehensive support for your health and personal care needs, making it much easier to manage care at home or in a care setting. Did you know CHC was introduced because of a legal case? The framework for NHS Continuing Healthcare funding was largely established following a legal case in 1999, the Cochrane case. It clarified that people with primary health needs should have their care fully funded by the NHS, not means tested. Applying for NHS Continuing Healthcare funding starts with a referral from your GP or a healthcare professional involved in your care. Once you're referred, a full assessment will take place. If you're already receiving care, your care provider might also be involved in the process. If you believe you meet the eligibility criteria, or you've been told you might be eligible, it's important to ask your healthcare provider or local NHS team to start the assessment process. If you're unsure about the application or need help navigating the process, we're here to help. Don't hesitate to reach out to us for guidance and support. If you don't qualify for NHS Continuing Healthcare funding, you might still be eligible for other forms of support, like NHS-funded nursing care or social care services. Even if you're not eligible for CHC, it's always worth exploring other financial options available to you. For example, attendance allowance, local authority support, or direct payments could help ease the financial burden. Did you know CHC can save families thousands of pounds annually? For those living in care homes, CHC funding can save families an average of £50,000 per year or more in care costs, a significant financial relief for those with long-term conditions. We hope this video has helped you understand what NHS Continuing Healthcare funding is and how it could support your care needs. If you think you or a loved one may be eligible for CHC funding, or if you need help with the application process, feel free to contact us today. We're here to support you through the process and ensure you get the care you need. For more information on NHS Continuing Healthcare and other funding options, check out our other videos or visit the website for helpful resources. Remember, you don't have to go through this alone. If you have any questions or need assistance, we're just a call or a click away. Thank you for watching. Hwyl fawr. Goodbye.